Hello everyone, I'm Judge Slackman. I work as a holistic mental health counselor as well as an energy healer and hypnotherapist. In this video I'll be speaking about the topic of working with clients who express or demonstrate some form of suicidality. And to start this presentation I want to provide the disclaimer that this is for educational purposes, so the video is not intended to replace or substitute for care from a professional healthcare provider. If you have any mental health concerns or issues that you'd like to address, you can seek out care from someone who's qualified to assist you. And now to proceed with the topic of this video, suicidal clients and mental health interventions. So many people who appear or act suicidal have experienced a lot of abuse, manipulation, and exploitation in their lives and feel that they lack power or control over their external circumstances. For some of those people, choosing how and when to end their life may feel to them like one thing that they do have a chance to exercise power or control over. Mental health professionals naturally tend to be anxious and insecure about dealing with a suicidal client and feeling responsible if that other person they're working with follows through to end their life. The professionals are often taught to try to get the client to sign a contract to agree to not commit suicide, or to have that client hospitalized, committed to a psychiatric unit where doctors will likely impose emotion suppressing drugs on that person to suppress their desire to act on suicidal wishes. Of course, these are further incidences of people trying to control the person and make them conform to what others want, while perhaps denying or suppressing their own feelings. While those interventions may temporarily pause a person's suicidal impulses, they can actually aggravate the underlying feeling of powerlessness and the person's wish to exert their will, leading to increased risk of future suicide attempts. There isn't a one-size-fits-all protocol to help people in that state, and trying to apply efforts to control behavior rather than maintaining presence and compassion can have the opposite effect of what is intended. If you look at many different studies examining the effects of mental health treatments, in particularly regarding depression and suicidality, you'll see that first with antidepressants, those are found to actually increase the risk of suicidality or suicidal behavior. So you would think that an effective measure to heal depression would reduce suicide, but those medications are actually associated with increased suicides. You'll see the same thing with psychiatric hospitalization. People that are committed to psychiatric facilities show an increase in suicides in the time period following those inpatient hospital stays. So somehow these interventions are not actually helping the people in many of those cases. It might be doing more harm than good, so to speak. So we really want to rethink and reconsider the approaches to supporting or assisting people who are exhibiting suicidal thoughts or behaviors. And the first step, as I'm observing, as I'm viewing this issue, is to not invalidate that person, to not try to impose control over them, but to actually have some presence and compassion, to seek to listen and understand and have respect for what they are truly feeling or thinking in the moment, to recognize that it's sometimes a natural, valid part of life to feel like you want to end your life. Anyone could experience that at any given time. It's not bad or wrong to think that. And even if someone were to follow through with that, that's ultimately not bad or wrong either. From a spiritual or metaphysical perspective, the spiritual aspect of who you are can't actually be killed or destroyed. It's just that physical body, which is temporary to begin with, that's dying or ceasing to exist. If we think about why people end up in a state where they feel they want to end their life, we can consider there's multiple potential factors contributing to that, and they all have some deep emotional elements to them. A person may feel just overwhelmed with some form of stress or pain or suffering in their life, and they don't want to continue to experience that. They want to have relief or escape from it. Sometimes that might involve some feeling of guilt or shame about what a person has done or not done in their life. So a lack of self-worth or self-esteem, a sense of being in some way a bad person. There are also people going through intense physical suffering, and they may feel there's no hope of recovery, no hope for improvement. They may believe that they're going to continue to go through deep pain or suffering if they continue to live, and they'd rather not live as a result of that. And the same thing with emotional pain. People may be experiencing that and believe that there's really no way out of it or through it, that they're not going to be able to see improvement or recover from it. So as a clinician or anyone seeking to support that person, you don't want to begin by just saying that that's not a valid experience they're having. It's their reality, it's what they're going through. And you can first acknowledge and accept that that's their actual reality, what they're feeling in the moment. Doing that first before you try to intervene in a way to help them see some alternative or something to live for, or some possibility of improvement in their situation or their ability to handle whatever they're experiencing, whatever suffering they're going through. It can seem very challenging for a therapist or for any practitioner to face a person who's going through that pain and suffering. But if you're fearful of it, if you're judgmental about it, that actually interferes with your ability to be present, to be nurturing and compassionate, and to provide some form of energy or consciousness that could actually help that person shift and become more open to continuing their life and choosing not to end it. So first, as a therapist or clinician of any kind, you can look at yourself and your reaction or response to encountering someone who's suicidal, and kind of regain your centeredness, your composure, your patience with that situation, so that you can bring kind of more peace and calm there and not add to or compound that person's sense of fear, that person's desperation. I hope that this short introduction to this subject and this commentary on what is often the typical protocol or standard way of caring for a person who appears suicidal gives you some insight, perhaps a new way to look at this, an expanded view of how you can be supportive and compassionate and not afraid of what might happen. Ultimately, each person is responsible for their own life, for their own choices, and there may be situations where no matter what anyone says or does, a person may end up choosing to commit suicide, and that's something that I feel we can accept. We don't have to be afraid of that. We don't want to carry guilt or shame about hypothetically not having been able to prevent it. It's a reality. There will always be people who feel that that's the only choice they can make or the best choice they can make. It's been a part of human society, human history, and as spiritual beings, there may be a part of us that has a purpose in making that choice. There could be different factors involved, different contexts, and when we're no longer here in our physical body, when we're in the spirit realm, we can reflect on that life and how it ended, what choices we made, and assess that through our own soul's journey or evolution. The perspective of the soul may be quite different than the perspective of human beings here in the physical plane who are feeling some sense of grief or sadness about it. There may be a different view or different perspective when we're not immersed in our human identity. So it helps to consider that there are other perspectives. There may be a more expanded view of our human life where we're not so resistant to or fearful about people having suicidal thoughts or even carrying that out. For those that are seeking out additional resources for holistic health, for personal growth or spirituality, I invite you to visit my website, phinsights.com. That's phinsights.com. For now, I wish everyone a pleasant, wonderful day. Namaste.